So you have 11, possibly 12 protocols in front of you, and you may be overwhelmed, thinking that they're all different. But let me break down a couple of things or simplify it the best I can. Really, for most of the post-op protocols, once you get past phase 4, which is progressive overload, you're gonna have most of the precautions lifted. So therefore, you don't have to worry about protecting, messing something up. Here, it is your responsibility to make critical decisions to progress someone appropriately using the criteria to pass and the priority list that is under suggested exercises. So therefore, you know that you're doing the correct thing all the time, right? So just remember, for most of the protocols, for the first 3 phases, you have to be mindful of the surgeon's specific precautions, but more importantly, just the way you're supposed to progress, things you're supposed to avoid, just to make sure that you don't mess up anything that was done surgically. So with phase 4 and beyond, it's just a matter of progressing and finding out what's the best strategies to use in order to pass the criteria that is in each phase. What if I get a patient from another clinic 2 months out, 3 months out, and let's give this example of an ACL patient 2 or 3 months out. Since it's not a time-based protocol, you can make a critical decision based on criteria to help you place that patient in a particular phase confidently. For example, if they come to you 3 months out, if you notice in the protocols, that patient can be anywhere between functional restoration and progressive overload, if they are on track and doing really well per the performance-based protocols. Now, unfortunately, most of the time you're gonna run into the opposite, where they come to you 3 months out and they are not gonna be in phase 3 to 4. They might be in phase 2 or phase 3, or in 2 different phases based on how they present. For example, phase 2, they have to have a certain amount of range of motion in their knee, so 0 to 125, in order to get past phase 2. But you'll notice that they only have maybe 100 degrees of range of motion, but they have the ability to walk normal and the ability to possibly do half of the step down test. So you're in between, right? What I say is you always start where they are at the lowest phase, because you want to make sure that you don't skip steps and they have all the criteria they need in order before you move on. Now, it gets tricky sometimes where if a patient is in between phases and their strength is ahead of their range of motion, oftentimes I still have them move forward. But I will make sure that whatever is the priority list in the phase that they are ahead, so to speak, then I would substitute wherever they are. Give you an example. So phase 2, if they're lacking that 125 range of motion for their knee flexion, I am hammering home their range of motion in their programming, and then the strength comes afterwards. Because range of motion still was the priority in phase 1 and phase 2. Unfortunately, it may not have been the priority when they were rehabbing somewhere else. So you have to make up for that. There are time frames for each phase. So with that being said, you don't necessarily, again, these are not time-based protocols, but they at least give you an idea of where you want them to be, and then also gives you overlap in these time frames for those that are progressing pretty early, right? You still want to be mindful of healing times. For example, there's a patient that I'm currently seeing who is already in phase 3, but they're only 4 weeks out from an ACL surgery, ACL reconstruction. So phase 1 and phase 2, they've passed and they're already in phase 3. And if you notice in phase 3, I already start doing more advanced strengthening exercises, but I have to be careful because he's still within that healing phase and technically protection phase, right? And so you have to be mindful, but at the same time, it's good for you to not hold anybody back. You just may have to make some changes and adjustments along the way to either slow someone down that's moving too fast for healing time purposes, or if they are behind, understanding that, okay, I still have some time frames that I still want to achieve in order to keep their rehab progressing on a timely fashion. Let's talk about the criteria to pass. I've had some questions from those that have purchased the protocols in regards to how difficult they are. And do you really have to wait till they pass that criteria, even if they probably weren't able to pass it prior to their surgery? Those are great questions, right? What I try to do is, first, I always try to see where they are fitness level and baseline wise on the uninvolved side. So I'll give you an example. There's two different patients. One patient, her name, I'm gonna make this up, her name was Sarah. Sarah, on her uninvolved side, was able to do 25 single leg squats to the box, as well as 30 of the lateral step downs with her back against the wall. She struggled on her surgical side being able to do those, but the standard stayed the same because she can do it on the uninvolved side. Fast forward to another patient, her name is Karen, older patient that had tore her ACL during a skiing incident. And so I did single leg squat the box with her. On her other side, she was able to do 10, so the uninvolved side. On the surgical side, she was only able to do 8. So the question would be, do I force her to do 25 single leg squats, or do I hold her back until she can do 25 single leg squats on both sides, even though her uninvolved side, she was able to do 10? The answer will be, it depends. So Karen wants to get back to skiing, and Karen does not have a lifestyle that involves high level performance in terms of recreational activities. So I am going to use her other side as the standard, which was 10 single leg squat the box with good form. She did 8, but it wasn't good form, and she wasn't able to show good eccentric control. So once the other side, the surgical side, looks like the non-involved side in terms of quality and volume or repetition, then I would move on, because she's not looking to get back and probably won't go through all 7 phases. She'll probably get to phase 6, which is deceleration. I want to make sure that she can land properly and absorb forces that she will be required to do when she goes back to skiing. So I want to make sure she at least can do those things in a safe manner, in a confident manner. Now let me give you another example. If this was a high school athlete that had the same presentation as Karen, my example, where she was only able to do 10 single leg squat to box on her good side, and we asked that she does 25 single leg squats to pass, for criteria to pass the progressive overload phase, then I am going to program in a way that I want her to be able to do 25 single leg squats for both particular legs. Why? She's returning and will continue to play competitive basketball or whatever sport that she may be looking to return to at a high level, and possibly collegiately. I want to make sure that she is meeting the standard that I have set for those that are high level performers, high level athletes. So that is another example where you have to make the decision based on the patient's goals, where they are, and then also what they're looking to do going forward. And another question I get, I just want to make sure I address it, which is, does every patient have to pass all 7 phases? The answer is no. In fact, I've had a couple of patients that get to the deceleration phase and usually stop there. They're normally older, but more importantly, they don't have any goals other than being able to jog, other than being able to play pickleball or so forth. So their goals and their return to sport activities are not as demanding as high-level basketball, volleyball, soccer, that a lot of the teenage and collegiate athletes are going to play, or professional athletes are going to play. And so those demands are different, so therefore the expectation, the criteria in order to return to full capacity, which is phase 7, to return to sport, we're going to make sure that they pass those phases, as well as a psychological test before they return to sport.